to provide a bit of information on the our general framework of work and the mandate. Since 2022, across the WHO European region, spanning 53 member states, we all follow and have aligned the targets with the global health sector strategy, with the global HIV plan until 2025. And for the first time in the region, we have a regional action plan that not only focuses on ending AIDS, but also the epidemics of viral hepatitis and sexually transmitted infections until 2030, as well as a cross-cutting strategic direction that focuses on a shared response to HIV, viral hepatitis, STIs within the universal health coverage and the health systems approach. And why I would like to make this a specific focus is that we know that this year the UNAIDS and also UN co-sponsors theme is My Health is My Right. So we look at ending AIDS through the lens of universal health coverage, equity, as well as rights. Each of the regional action plan strategic directions have priority actions, including of improving services, decentralizing them, making people-centered and integrated, as well as focusing on the getting back on track. In the times of multiple crises and a continuing crisis, getting back on track means a dual track approach. We get back on track while we work towards ending diseases goals. And obviously, sustainability in key populations are some of the important topics that cut across all three areas of work. In terms of priority actions for countries, strategic testing, urgent treatment scale-up, and revamp prevention, as well as creating data and rapid uptake of innovations are some of the key areas for the WHO European region. Now, if we move to the statistics, so what you can see is the data from last year. We're planning to issue this year HIV/AIDS surveillance report together with ECDC in a 10-day time on November 28th. So for now, we are still operating with 2022 data. And what we are seeing is an increasing gap between people acquiring new HIV infections, according to estimations, as well as a decrease in the number of HIV diagnosed cases in both eastern side, western part of the region, and the western part, central part and western part. So that's very helpful to understand when to put into perspective what comes through case reporting and how countries interpret it. Because what we're seeing is since 2020, after the decrease in the number of reported cases because of the COVID-related disruptions, we are not seeing an improvement in the case reports. And this is a negative trend, not a positive trend. We have seen in 2022 an increase in reported cases, but this is a mix of things. It's a mix of, as you remember, 2022 was a year of massive disruption across the region because of the Russians' war against Ukraine. So many of the countries on the receiving side in the Western Center have seen increase in number of new cases, reported cases, previous positive most of the times. But we're also seeing an increase in uptake of testing strategies. And in the eastern side, in some of the countries, this is already a positive result of recovery. Similar for the AIDS diagnosis across the European region in 2012-2022, we are seeing a decrease in AIDS cases, which is also an indication of the fact that treatment uptake and increase in treatment coverage has reduced the number of AIDS diagnoses over time. Now, at the same time, we haven't seen much progress in terms of when people are diagnosed. So in 2022, 53% of reported diagnoses were diagnosed late, which means that CD4 counts less than 350. And this is a finding that is evenly spread across the region, and both in the West, in the East, and in the center. But it increases with age. First of all, the older age at reporting the new diagnosis, the higher likelihood that it's a late diagnosis, as well as highest in the heterosexual men, and the lowest in sex between men as mode of transmission, and equally affecting both men and women. Now, if we look at the HIV testing and treatment cascade in 2022, the region has not met the 95 targets as a whole. The western side was very close at 93, 94, 97, and reached almost there for reaching the 95s, and a few countries already achieved. The center is closer at 85, 85, 94, but the eastern side of the region is still far away at 62 of the number of people who are estimated to know their diagnosis from those estimated to be living with the disease. 82% of people with an established diagnosis on treatment, and 94 virally suppressed among those who tested. So at the same time, it's not all bad news. If we look in time, since 2015, when the SDGs were set, we do see an overall progress towards the targets. If among the 395s, the obvious highest progress is in the number of people on treatment, at 86 currently in 2022, but still almost 10% less than 95 target that will come in 2025. Obviously, for the first 95, we're still well behind anything that could be plausibly showing a progress in the region towards the first 95. Again, the data is not uniform, and if we look at how this plays out in countries of Eastern Europe, specific countries in Eastern Europe, we do see that from the countries that have data available, 8 out of 9 countries improved their rates in 23 compared to 2015. And all countries reported higher rates higher than the regional average. Of note is that since 2022, there is no data available for Ukraine for the cascade, and being the second burden in the European region, this definitely is a limitation to being able to assess the overall progress in Eastern Europe and Central Asia. If we are looking at the progress towards treatment enrollment and people being on treatment, so 7 out of 9 countries improved the antiretroviral coverage among those who know the HIV status in 23 compared to 2015. And the average for EECA is 85, and 3 countries have reported rates above regional average. And you see it's Belarus, Kazakhstan, and Tajikistan. Obviously, for the last 95, the results are much better, and some of the countries have shown impressive progress, like Kazakhstan and Kyrgyzstan. from 60 in the 60s, the targets in 2015 to almost reaching 95 in 2023. And all countries are close to or over 90. So this is by far the best performing part of the treatment cascade. At the same time, we know that the last 95 means virally suppressed among those who have been examined for viral suppression. So this does not show the full picture of the actual situation in the countries, and that's the limitation of it. So the other part that I wanted to also mention is that for TB, HIV, the region is also quite behind in making sure that all people who have been diagnosed with HIV receive TB preventive treatment. And in the period of 2018-2022, only 11% of the target people have been treated for received TB preventive treatment, and that is in a region with high MDR TB burden, where this is a make or break, sometimes a life-saving intervention. And you do see on the right-hand side what happens if a TB is not prevented. So in 2022, only 48% of HIV-positive TB cases had successful treatment outcomes, lower than the global rate of 79. So let's just say that this is an unresolved area after many years of TB-HIV collaboration. That still TB is one of the leading cause of deaths among people who live with HIV. I would like to use the opportunity to also mention some of the latest WHO guidance this year. These are some of the important guidance that have been released by WHO. One is consolidated guidelines on differentiated HIV testing services, which basically focuses on changing and making self-testing a stronger recommendation, and expanding it to those who are using PrEP. Also a recommendation on network-based testing for all with risk, not only key populations. The other guideline for HIV post-exposure prophylaxis, basically the key topics covered, or the key takeaways, is that the earlier start, the better. So availability, including in community settings, is very important, and the preferred regimen is TLD, that decreases the pill burden, which is readily available in the countries already. The third one is WHO implementation tool for pre-exposure prophylaxis, which provides guidance for further differentiated services and simplified services, expanding for all people at risk, and also adding recommendations for dapivirine and long-acting cabotegravir. Stigma and discrimination, this is the first time that is being addressed by WHO in form of a technical brief that focuses on quality, on stigma-free care, and brings examples of good practices with key takeaway being that health stigma in healthcare settings can be effectively reduced. And finally, re-engagement in care. The fact that we are into the fourth decade of the epidemic, and many more people live longer, healthier lives, and can continue this for decades, moves the shift from just testing and the linking to care to long-term care, on the importance of adopting differentiated service delivery, strengthening the monitoring and evaluation system to track, importance of community-led services, and non-punitive, non-judgmental environment for those who are coming back into care. And finally, 5 takeaways. Health is a human right, so focusing on access to evidence-based health services for everyone and understanding who's left behind and removing barriers is very important. Stigma and discrimination undermine the fight against AIDS and still prevents many people from coming forward to health services. But it is possible to reduce stigma and discrimination in healthcare settings, and it's not an unsurmountable task. Communities at the forefront. In Eastern Europe and Central Asia, the role of communities is essential in ensuring access to services, and the services must be adequately funded to ensure sustainability and ultimate success of the HIV response. HIV has become a chronic and manageable condition, and services require long-term planning with constant monitoring and tailoring response. The cascade is also dynamic, not static. So this shift requires also better data, and more focus on the treatment initiation, from treatment initiation to retention in care. And my final point is that HIV prevention and testing have undergone a revolution and are continuing this path. But in WHO European region, we are very slow and very low in uptake of WHO recommendations towards testing, and we must do better. Thank you so much for your attention. I'll be happy to respond to any questions.